Good evening, and welcome to another edition of the Yuba Sutter Medical Explorer. My name is Dr. Robert Peppercorn, and my specialty is dermatology. I serve as host of this program. The purpose of the Medical Explorer is to explore the medical communities of Yuba and Sutter counties, and to take you behind the scenes of medical care practices right here in our local area. Tonight, the Medical Explorer will take you behind the scenes of one of our area's popular health clubs, and we will learn about the benefits and risks of many exercise programs and techniques that are available to the citizens of the Yuba Sutter area. One of our area's physicians, who also happens to be a fitness expert, will join us on our exploration of these increasingly popular exercise facilities. Our program tonight should be extremely useful and quite timely as well, and I hope that you'll stay with us for the next half hour. Before getting to our topic tonight, let's take a look at the latest medical news. Very appropriately, my first medical news story tonight concerns exercise and high blood pressure. Exercise is not a substitute for drugs to treat high blood pressure, a new report finds. But regular exercise, when combined with drugs, may help lower blood pressure in people with mild hypertension, the report indicates. It supports a growing view among doctors that recently published medical reports have misled many of the United States' 35 million people with high blood pressure by suggesting that non-drug therapies, including salt reduction and weight control, could substitute for medical drugs. For most people, exercise, weight reduction, and salt restriction just don't work, according to a professor at Yale University. Since the mid-1960s, stroke deaths have declined 40%, and heart disease deaths have declined 25%, which is attributed mostly to better control of high blood pressure through medication. The new report appears in a recent issue of the medical journal called Medicine and Science in Sports and Exercise. The report concluded that regular exercise, such as walking, jogging, and cycling, can reduce blood pressure by up to 5%. This may help people whose blood pressure is raised only slightly, but it fails to produce sustained reductions in people with higher blood pressure levels, those most associated with an increased risk of heart disease. My next medical news story concerns some hazards of swimming. Swimmers don't have to worry anymore about swimming after eating, but they do have to guard against herpes, ear infections, and skin irritations. Herpes virus is a serious risk to swimmers, according to a noted specialist in sports medicine. Chlorine, the chemical used to purify pools, kills herpes virus in water in seconds, but the virus appears to survive for up to 4 hours on the tiles surrounding the pool. The doctor advises to sit on a towel when you want to dangle your feet in the water. Herpes infects the body through a break in the skin, so if you have an open sore and there's not enough chlorine in the water, then you could be at serious risk. Chlorine, however, can cause eye irritations and ear infections. Many cases of burning bloodshot eyes have been avoided thanks to protective swimming goggles. Swimmers' ear affects about 50% of daily swimmers. Chlorine washes out the outer ear's protective acid, allowing bacteria to set in and for fungus to start to grow. Chlorine can also strip skin of its oils, leaving it dry and very itchy. An after-swim shower, followed by rubbing baby oil or a moisturizer on the skin, is a very good protective measure. Probably the most practiced swimming health tip, waiting 30 minutes after eating, is an old wives' tale according to the American Red Cross. You don't have to fear the cramps if you have a sandwich and then jump in the pool. My final medical news story concerns drinking water after exercising. Most of us are better off drinking plain cold water after exercising to prevent dehydration than using electrolyte and carbohydrate-loaded athlete drinks, according to a professor of preventative medicine. Only athletes participating in marathon-type activities might benefit from the commercial preparations, and even those athletes should dilute the drinks until they can be barely tasted. In anything less than a marathon, electrolytes, potassium, sodium, and chloride, lost through perspiration, don't impair the body's functioning. And even the untrained jogger has enough stored carbohydrates to participate in 60 to 90 minutes of activity. The sugars in these commercial drinks, such as Gatorade, may also slow rehydration and carbohydrate absorption. My health tip tonight concerns picking the right health club. We have all noticed a tremendous proliferation in the number and size of health clubs in the Yuba Sutter area during the past few years. How does one go about choosing the right club? More and more people are becoming part of a regular fitness program. If you're thinking about joining one of these health clubs or a fitness center, be aware that the kinds of services each club provides and their health and safety policies vary significantly. In addition, licensing requirements have not been established for fitness center trainers, and many centers are staffed by people with no knowledge of biomechanics or exercise physiology. For these reasons, it's important to carefully evaluate a club before joining to ensure that you don't endanger your health while you're trying to improve it. Few people realize that anyone can own and operate a health club without adequate training in how to achieve physical fitness. Some centers are run by a medical advisor with a professional staff of fitness experts, while others are owned by a business person who has hired untrained personnel to supervise workouts. Before joining a health club or participating in a fitness program, be sure that the staff on duty have received training in physical education, exercise physiology, or a related field. Sign up only if a program is well supervised by trained and experienced personnel. It's also important to make sure that the club you join has taken the health and safety precautions necessary to ensure safe workouts by its members. A complete health club or fitness center will have a pre-assessment physical evaluation or recommend a health screening for all new members. This screening is essential to determine the intensity, duration, and frequency of an individual's workout program. Without a screening, it's all too easy for an individual to be placed in a rigorous exercise program that could endanger his or her life. It's a good idea to have a thorough physical examination and consult with your doctor before beginning an exercise program, particularly if you're overweight or have experienced any cardiovascular or musculoskeletal problems. The club you choose should have an emergency policy and ready contact with an emergency medical service in the area in case of injury or illness. Now, on with the Medical Explorer. The Yuba City Racket and Health Club, located in South Yuba City, is one of our area's very popular fitness facilities. Let's explore some of the many exercise options that are available at this club, as well as others in the Yuba Sutter area, so that you can determine which physical fitness technique is best for you. We're standing outside the beautiful Yuba City Racket and Health Club. It's a fantastic day to be doing things. I'd like to take off from my office, but I don't think I can. With me right now is Judy Jacoby, the manager of the Yuba City Racket and Health Club. Thank you very much for letting us come here today.
My pleasure.
Can you tell us a little about the history of your club here?
Sure. We've been in existence for about 9 years, generally as a racquetball and tennis club. In the last few years, we began to think much more about the other aspects of exercise that make for a good racket and tennis ball player, and therefore we've expanded and turned our club into a full facility. Now it's called a health and racket club.
What are the facilities you have here now?
Well, now we have our 10, our 10 tennis courts, 4 racquetball courts. We have a Nautilus room with equipment that you use to strengthen your muscles, and a free weight room where you actually gain strength. We'll go into that more later when you get in there. We also have a swimming pool indoors and outdoors, jacuzzis, saunas, life cycle bicycles, name it, we have it.
Well, today the Medical Explorer is going to take the chance and the opportunity to go in there and actually learn some of the benefits of these exercises and maybe some of the dangers of some of these exercises. So can we go in now and begin?
Certainly.
Just lead the way.
All right.
Well, what room are we in right now, Judy?
This is our Nautilus room. We have 25 pieces of equipment in here, 20 of them Nautilus and 5 Universal. And waiting here is Dr. Hilger, who will explain
I've been waiting for Dr. Hilger myself. Bruce Hilger, MD, obstetrician gynecologist from the Marysville Medical Clinic.
Proposed health expert, too.
Well, that's why you're here today. You, for a long time, have been interested in health and exercise. You've been yourself involved in a lot of exercises. I'd like to just have you tell our viewers about your educational background briefly, if you don't mind. Where did you go to school?
Well, I went to medical school in Chicago at Northwestern University, and and prior to that was in college up in Washington. All through either high school, either college or medical school, I had some athletic experience of my own, and I've continued it even now. And fortunately have children that are involved in athletic pursuits as well.
What are some of the general benefits of exercise?
Well, just seeing some of people who are my patients and some of their problems and experiences that they're having, I think the athletic type of approach to life improves the way you feel and has a tremendous advantage in people's everyday lives.
So we have benefits really to more than just the physical part of our body. We have other benefits as well.
But also at the same time, you have to consider the secondary problems from your athletic venture, whatever it may be, of overdoing something or side effects from your exercise that have certain medical implications. And I think that's the reason why having a health complex such as this to organize somebody into a program would keep them away from developing complications or problems of doing their exercise.
I agree. But what I'd like to begin doing today is going through the club, looking at the different individual exercises, and then have you comment about what you see personally as the advantages and disadvantages of each exercise from a medical perspective.
Fine.
Well, let's start off by looking at the Nautilus equipment, and we have an expert here from the club, the fitness expert. Ron, can you come on over? Ron Petersen is the fitness consultant here at the Yuba City Racket and Health Club. Where do you work besides the fitness, as being a fitness consultant?
I teach at Yuba College.
What do you do out there?
I'm in the physical education health department.
So you really are an expert in all aspects of health, education, physical fitness education, that sort of thing.
I'm not sure I would go so as far as say that I'm an expert, but I had a great deal of experience in education.
I've heard good things about you, so I would say that. We're now in a room filled with equipment, and some of it looks sort of scary to me. Can you tell us what is all this equipment back here?
We have a complete line of weight training machines on this particular floor in the fitness club. And with these particular machines that we have, we are able to accommodate exercises for any type of program that people want to do on machine work. We have, you mentioned Nautilus, but we also have some other brands of equipment that also accommodate people quite well, as do the Nautilus machines. But we've set up the program so that we can design individual programs for people no matter what their goals are in the area of resistance training. And with the aspect in mind that most of the people that go see doctors today will have some sort of low back problems, the majority of the people will, and we have many machines and exercise programs for people to take care of that particular aspect as well as general fitness.
So in this particular room, there's machines that I guess can exercise every part of your body. Is that about it?
Just about, yes, we do.
Could you just show us one of these machines? How about this one right near us? What would this do?
All right, this particular machine is designed to work the back and the deltoid area of the upper shoulder area.
Could you just sort of get over there?
I'll step in. What you do is you immobilize your upper body in the machine. You're going to put your arms in front of you, elbows at shoulder height, and then you move your arms out laterally to the side and contracting the muscles in the rear of the shoulder and the upper back, and then you bring them back. And this is the type of exercise that we have a lot of people doing, because one of the areas that is neglected is the upper back in terms of a well-balanced weight training program. So we try to include machines and exercises for people so that we can get a total workout program and not just a specific program.
So I see that here you are using specific muscle groups with this machine.
Exactly, and that's what the machines are designed for, is for a specific range of motion and to work specific muscle groups.
Now, Dr. Hilger, what do you see as the advantage of this type of exercise to someone?
Well, I think one specifically that Ron mentioned is somebody that would have a back problem. And a lot of that is from either muscle spasm in the back or not having enough muscle strength. And this machine, not particularly, but another type of machine would be ideal, where he could get somebody onto an exercise program that would help that particular back problem. Obviously, a disc would be a different situation.
Are there any risks that you see in this type of exercise?
Well, you have to consider the person's medical background. In other words, if somebody had some cardiovascular problem like a heart problem or hypertension, this would have to be taken into account, because if you're straining on one of these machines, your blood pressure can sometimes double or triple just in the straining process of doing the exercise. But if somebody were to keep it at a multiple repetition type of exercise where they weren't straining hard, they would give the muscle the exercise that it needed without overdoing it on their heart or their blood vessel system.
And this is a time during the exercise when we're not measuring their blood pressure. We really don't know how high it's going.
Exactly.
So you wouldn't want to start with a high blood pressure and make it even higher.
No, but what Ron would do would be able to give somebody a graduated program where they would start light and build themselves up, and seeing what the effect of the exercise would be on their body.
The exercise bicycle, I just purchased one of these, not quite this fancy, at my house, and trying to get myself motivated to do this every night while I'm watching television. What kinds of advantages am I going to get from exercise bicycling?
Well, you could hook an electric generator up to it and run your television off of it, I would presume. The program that's designed for these life cycles is about a 12 to 24 minute program where you go through a phase of pedaling, getting your pulse rate up to the ideal level. Now, this is figured out mathematically. If you maintain that level of pulse, you are getting the maximum cardiovascular benefit out of it. And this is maintained either by swimming or bicycling or doing the aerobics, jogging, or any kind of continuous activity program like that.
Great. Now, what are we doing besides just exercising our heart here?
Well, the quadriceps is the largest muscle in the body, so you're working them.
Which is the quadriceps muscle?
The thigh muscle, or between the hip and the knee. Cross-country skiing probably does a better job because you're using your arm muscles. But on these particular machines, you're getting an ideal form of exercise where I think Ron here, if he worked hard enough, could get his pulse up above 200 if he wanted to.
Aerobic exercising, jazzercise, seems to be a very popular type of exercise in our community. We see it at health clubs throughout. What are the advantages of this type of strenuous exercise?
This is different than what we were seeing downstairs with the Nautilus and the weightlifting equipment. This provides a stimulus for the cardiovascular system. The heart rate is the key thing that you monitor with aerobics, but it also provides a way of developing flexibility. And I think aerobics has been an excellent addition to the health field as far as health maintenance.
So, as in the exercise bicycles, this is exercising the cardiovascular system?
Correct. What you're doing down there is you're developing strength or power, whatever you want to call it. In this, you're developing your cardiac system in a way, you're maintaining a heart rate level that's higher than what ordinarily it does for a longer period of time. And in this way, the blood vessels and the heart are getting some sort of practice, and it has I think people have shown generally that it has long-term benefits for people.
Are there any risks from this type of exercise?
Well, for instance, I'm in obstetrics, and with pregnancy, there is some question about how much exercise you should do in that particular condition, and I tell people to monitor their pulse at rest and then during the exercise that these girls are doing, and to see what the pulse rate is. There are formulas that you can use for determining maximum and then your exercise pulse level, and that's probably the best one that you should follow. The other thing is the limbering that this does for your joints and muscles. This is a tremendous secondary effect of the aerobic plan too.
The weightlifting room. This has always been sort of fascinating to me, the tremendous weights that people are able to lift and strain their bodies. Yeah. Well, let me ask Ron. Excuse me, let me just ask Ron. Ron, you've had a tremendous amount of experience with weight training. What's the advantage of this type of exercise? What are you trying to do? You're not trying to make everyone look like Mr. America, are you?
Obviously not. But what the biggest advantage of lifting free weights over machine weights is in the area of joint stability. Because there are minute balance movements that take place when you handle the free weights as opposed to machines, you're going to gain a great deal more joint stability. So the people that are interested in athletic training, training athletes, we encourage them to use a combination of free weights and machine weights. And there are certain exercises that you can't do on machines that you have to do on free weights and vice versa.
I see. So people of all ages, all sexes are now using weights. Is that true?
Absolutely, more so all the time.
Why would a lady who's not involved in any competitive athletics want to use weightlifting?
Well, strength is very important for everybody. Strength is one very important attribute of being totally fit, along with other attributes of aerobic fitness, as we talked about already. But strength is very, very important. Muscle tone is very important. We want to make sure that the body stays in proper alignment. And as age approaches, we start to sag. Gravity starts to take over, and we can counteract that somewhat by maintaining good muscle tone, good posture, and it helps the entire physical being.
Great. I think I'll switch over to Dr. Hilger and ask you, these tremendous weights, there must be some risk to this type of exercise.
Well, I hate to have Ron take all the good things, and I'll talk about all the bad things, but one of the initial problems in weightlifting is straining and tearing a muscle or hurting yourself by just overdoing more than what you should be. And by practicing with the weightlifting, like the young man that was doing the squats, you develop a coordination and an understanding of how the apparatus works. And as you familiarize yourself with this, then you decrease the likelihood of having any kind of overuse problem with it.
What could happen if someone like myself, who hasn't lifted weights in 15 years, would all of a sudden come here and try lifting weights like
One, well, you wouldn't be able to lift the weight if you pick too heavy a weight.
That's true.
The other is that you'd wake up probably tomorrow or the next day feeling terribly sore.
So straining things is a problem.
Yes, yes. And by working on a regimented program of 2 or 3 times, probably 3 times a week, would be very helpful. I personally have found weight training to be beneficial to the competitive sports that I do. As you get older, I have found that I need more weight training for muscle strength.
One of the people most active in exercising in Yuba City, I understand, is Ida Sibley. You've been exercising quite a bit for a while. You not only come here to swim, but you have quite a walk to get here. Isn't that true?
It's quite a walk, but when I was younger, I walked a lot, so now I'm starting in again. I'm my second childhood now.
That's fantastic. You come over a mile here every day?
A mile and a half each way.
And then how much swimming do you actually do?
Well, about 14 laps, but I stop. I'm not trying to break any records. I'm just trying to enjoy it.
Fantastic. How old are you, if you don't mind me asking?
Yes, I celebrated my 78th by joining the club.
Fantastic. Congratulations. Great year for you. I think it's important for our viewers to realize that exercise is not something just for teenagers, children, and young adults. It's for everyone.
It's marvelous. I just can't believe it. I just feel as I'm starting a brand new life, and that everything in the past has culminated to this, and now I'm thoroughly enjoying the difference and having the leisure to do it or something.
Well, Mrs. Sibley has told me that she doesn't want us to keep her from doing her swimming today because she has some things to do after this. So I think we'll let you get back to your swimming right now.
Thank you.
Mrs. Sibley has an interesting medical story in that her doctor told her that she had to reduce her blood pressure with medication. And she decided that she wanted to start off exercising and discovered that that could lower her blood pressure in itself. Is that something that's common?
And people have found this with certain types of aerobic programs, whether it be jogging or swimming or even bicycling. You do get an effect of a lowering of the pressure from that activity.
But again, we should emphasize, you don't want to substitute this if your doctor recommends medication.
She took off and did this on her own, but I think it's a demonstration of what the effect. Swimming in itself, I think, is probably one of the least traumatic of the aerobic sports. You get muscular activity, but you also get the aerobic phase of it as well.
Hot tubs, whirlpools, cold tubs, things like that we see at all the health clubs in town. Some are nicer than others, of course. Some are bigger than others. People do like to sit in these things. I suppose it makes them feel good, but there have to be some things people need to know.
Yes, well, while they are very relaxing, and this is probably the effect that you're talking about, getting overheated in a hot tub is one of the problems that you can get into, and hyperthermia during pregnancy is one of the things that we're concerned with for people. In addition to this, the jumping from a cold water, a cool pool like over here, to a hot tub does have effects on blood pressure. So this is one of the things. And in addition to this, I'm sure there's no problem in this particular setting, but at the home, the hot tub problem is with certain bacteria that tend to proliferate in dirty hot tubs.
Racquetball, tennis, competitive sports that build up aerobic exercise, I would suppose, cardiovascular things,
And skills.
and skills coordination as well are very important. I like racquetball more than tennis because when I miss the ball, I don't have to run as far to get it as I do in tennis when it goes halfway down the block.
That's
But
right.
there are nice advantages to all these. But I want to really emphasize some of the safety precautions people have to take in this sport.
One of the things that you did mention, racquetball is a more vigorous sport than tennis. Played even by an average player, there is more exercise put into playing racquetball. Some of the disadvantages or some of the problems that you have to face up to in racquetball are with that ball floating around down there. You have to be very cautious about eye injuries, and so there are plastic eye protectors, eye guards that everybody wears. And
We should mention these gentlemen on the court now don't have those eye protectors on because we just pulled them off the tennis court so they could be playing racquetball on the show. But ordinarily they would have eye protectors.
that's true, and they're wraparound so that they protect the side of the face as well as the eye itself and the bones around the eye. The other problems I think here where you have to be cautious about are you can develop a blister very quickly running around on these courts.
I'd like to thank the staff and members of the Yuba City Racket and Health Club for allowing us to explore their very nice exercise facilities. Again, please remember that the Medical Explorer program does not make specific recommendations about health clubs and exercise programs. Before choosing a program or club, consider discussing specific exercise options with your doctor. I'd like to invite you to write to me at my dermatology office in Yuba City with your suggestions for areas and people that you'd like to see on this program. As you know, the Medical Explorer is a public service program, and I really do want to hear from you with your comments and suggestions. Please write to me at 367 Del Norte Avenue, number 4 in Yuba City, 95991. In my next program, the Medical Explorer will take you behind the scenes of more interesting frontiers of medical care practices in the Yuba City and Marysville area. Till next time, I'm Dr. Robert Peppercorn, your Medical Explorer. Thank you for joining us tonight, and have a good evening.